www.healthcmi.com, Acupuncture Continuing Education Online. Today, I want to talk a little bit about respiratory health. Now, this is very important because there is a COVID-19 crisis pandemic globally. We have some interesting articles on that topic. So if you go to healthcmi.com, click on news, you'll see a variety of articles on acupuncture and herbal medicine and what we can do for patients suffering from COVID-19. One thing you'll find is that when people lose a sense of taste and smell, mostly they'll get it back within a week or so. It tends to come back gradually. This is one of the symptoms of COVID-19. However, some people in the long haul do not get it back. What can be done is, especially a type of scalp acupuncture around Shenting, which is acupuncture point D24, we also call GV24, triple parallel needle technique with the Professor Ming-Ching Zhu, Zhou Qi, and Jing Qi techniques. There's a lot that can be done there, and we teach acupuncturists quite a lot at healthcmi.com on those types of approaches to help restore a sense of taste and smell. So acupuncture is quite good for that. In terms of herbal medicine in the throes of a fever and things like that, keep in mind simple herbal formulas like Lianhua Qingwen are over-the-counter drugs that are reimbursable by insurance in China because they have been proven by modern research, to prevent viral replication of COVID-19. So very helpful, especially in early stages, because it has a little ma huang, which has ephedrine in it. It is hard to get in the United States. It's legal for acupuncturists to use. However, importers aren't allowed to import it, which makes it almost impossible to get. And furthermore, a lot of malpractice insurance companies for acupuncturists won't let them use it also. They won't cover them. And that's because it has the ephedrine in it. It's ma huang is the ingredient, and you would find an artificial version of that in Sudafed, for example. So back in the day before there was a drug crisis, where people are abusing these things and concentrating them into drugs, you could just buy Sudafed over the counter and it wasn't an issue. And then, of course, now pharmacists have put it behind a counter somewhere where you have to ask for it so that people don't abuse even Sudafed, which is Suda, meaning artificial, and Afed is for ephedrine, or ephedra, which is the herb ma huang, is ephedra. So same problem that people were abusing the herb and then it became harder to get. But Lianhua Qingwen does work quite well for restoring breathing and bringing the fever down. It also has a very important Tibetan herb called Hung Jing Tiam, which restores oxygen saturation to the blood. It increases your oxygen level and energy level. So it's what we call a clear heat and toxin herb, but it also, we say, tonifies qi. In other words, it gives you a little more energy if you're exhausted, and it addresses that fatigue. Long and short term, that herb is fantastic. So there are other things. For example, Tianjiang, which in the United States, for example, is distributed by Treasure of the East, makes really a top quality herbal formula, Qingfei Baidusan. And what they've done is they've modified it so that it meets all the FDA requirements. So they've taken out the Xixin and one other herb that you cannot use in the United States. Now, that does make it less effective, but nonetheless, Qingfei Baidusan, especially when there's severe coughing, phlegm in the bronchioles, things like that, is a great herbal formula, and you can get it from Treasure of the East. And what's nice is they've replaced some of those herbs that the FDA doesn't allow with ones they do allow, and that way you can use it and get safe, effective medicine. I've used it in my own clinic and got great results. And of course, Tianjiang, through Treasure of the East, they are known for their extremely high quality of purity and potency. So it's a good choice. And there's several others. Remember, there's been a lot of research. So if you want to see the research on each individual formula, go to healthcmi.com and go through the news department, because we've published quite a bit of the research. The United States, for example, is a little behind in that. They aren't integrating in hospitals a lot of the proven herbal formulas that help people. Now, the leader of the Chinese medicine effort in China, Zhang Li, has communicated directly with Health CMI in terms of some of the issues with COVID-19 and the spread of COVID-19. Basically, Zhang Li says, one, sputum bolts are a big issue, and those dissolved phlegm herbs really get at that and prevent the spread of it. And also, it's really about early intervention. The sooner you get to the patient, the quicker the herbal medicine and the acupuncture can get them better. And the outcomes are much better than without. It's not whether you get Western versus Eastern medicine. That's a false narrative. You're going to get what you need, but if you don't get the herbal medicine, you're not getting everything that medicine has to offer. Yes, you're going to need some oxygen, you might need surgery, you might need secondary infection antibiotics, etc., etc. Of course, hospitalization. That can happen. You might wind up in an ICU, but if that ICU doesn't have herbal medicine, you are not getting what you need because the research is there. Zhang Li is in charge of delivering that to the Chinese public, for example, and 92% of the Chinese population gets herbal medicine for COVID-19, and it's working. So we are talking about preventing people from dying and also faster recovery and preventing long haul and treating long haul. I do recommend people consult with their local licensed acupuncturist if they are suffering from long haul and there are some residual, let's say fatigue or loss of sense of taste and smell. They can address that with herbal medicine, with acupuncture points like we talked about before, Shen Ting, do 24, which is really a wonderful point for restoring taste and smell. So I wanted to talk a little bit about respiratory health. All of us have been going through quite a bit with this. And some simple things. Yes, masks work. Yes, the vaccine helps. Yes, if you're concerned about it, there are some valid concerns, but you have to weigh that against the dangers of getting COVID-19 itself. And people have a much lower risk of dying from COVID-19 if they've been vaccinated. It's not a guarantee that you won't contract it, but it certainly will help you to have those antibodies in your body and antigens ready to go. So there's a lot of myths out there about all kinds of weird treatments. The Chinese medicine is not in that department. First of all, they've done a lot of research at medical institutions and clinical trials and laboratory investigations to find out what herbs are working, what aren't. There's a vast history of Chinese medicine for this. There was a coronavirus outbreak in 2003, the SARS, and we started doing our homework back then. So we have an early jump on this, and we're knowing what formulas are working. To licensed acupuncturists, it's not a mystery because coronavirus fits in the same scale that influenza does. In other words, it's still Shanghan Lun based or Wenbing based. It might be part of the 6 stages or the 4 levels. And we know how to get at it with specific herbal formulas that address this progression of disease. So it's no mystery that a lot of the herbal formulas are based on classics like Ma Xing Shigan Tang or Yin Chao San, etc. However, we see herbal formulas like Lian Hua Qing Wen a little more modernized, taking some of the newer discoveries. And by discoveries, I mean, we may say we've discovered that Hung Jing Tian clears heat and toxin and oxygenates the blood, but this is also news to the people who've been using it for thousands of years. So yes, we've discovered that, but in reality, we've just shown with modern science what people have been using is working, and that makes its way into the formulas that are getting to the people. And it's very formal, and it's hospital medicine in China. So again, go to Health CMI, take a look, and stay healthy and strong. I'm Adam White, licensed acupuncturist for healthcmi.com. Thank you for listening.